everyone, this is Dr. Charlotte with Peak Movement Physical Therapy. In this video, I'm going to be teaching you how to do a clamshell correctly. So the keys to a clamshell are correct setup, individualized movement at the hip joint itself, and correct muscle activation. Most people have done a clamshell before, but almost 100% of people always do clamshells incorrectly, especially in exercise classes when you're using bands, things are moving quickly, and you're not getting that muscle isolation. We want to exercise with intention. So the intention of a clamshell is to isolate your glute med muscle. If you put your hand on the side of your hip and feel for your hip bone here, my iliac crest is up here, that area in between is that glute med muscle. So that's where I'm trying to target. So to do this, you're going to lay on your side, finding your hip bone on the front. You want your top hip bone to be a little bit in front of your bottom hip bone. That's going to put you into a little bit of a tilt this way, forward towards the camera with your pelvis. And then from here, bring your legs up to about a 60-degree angle at the hip. And then from here, I want you to focus on, you're not just lifting the thigh up and down, which is going to get a lot of quad and hamstring activation. I want you to think about the movement is coming from the hip. You're going to rotate in that hip joint right in here, and the leg is going to come up as a consequence. Your pelvis should not move. Think about your pelvis and your hip as two different entities. My pelvis is staying stable, my top hip is forward, and then my hip joint in the socket is rotating up, slow, controlled back down. I'm rotating up, slow, controlled back down. You should always feel this exercise right in that glute med muscle on the side. If you don't feel it there, try adjusting. You can bring your hips up more, or you can bring your legs lower and try to really find that special angle, and then hip is forward on the top, remember, to where you're really isolating it into that glute med right there.